Each week in the UK alone, there are 135 amputations of legs or feet due to diabetes. Most of those patients will die within 5 years. Diabetes is the fastest growing health threat of our times and an urgent public health issue. Since 1996, the number of people living with diabetes has more than doubled. Long and short-term complications can impact on a wide variety of parts of the body, including eyes, heart, kidneys, nerves, and feet. But according to the manufacturers of this piece of kit, much of that surgery, suffering, and subsequent disability could be avoided. It's a Cellsonic medical machine. It's compact, easily transportable, and simple to use. And according to Cellsonic Medical, it heals bones, wounds, and nerves. It adds strength to muscles. It's non-invasive with no side effects and doesn't involve the use of drugs. Now, I'm an independent television journalist and documentary maker. I'm not a PR man. And the big question is this: if Cellsonic does exactly what it says, why aren't there machines in every doctor's surgery and hospital? It would save health services a fortune. Are the wonder treatment claims on the website the work of quacks and spin merchants? Cellsonic Medical challenged me to find out, to dig deep and report the facts. Cellsonic is registered in the UAE and production is in India. There's a worldwide network of sales distributors. It's hoped to establish a UK manufacturing base to cater for what's anticipated to be exceptional demand. Designers say this is more than a sophisticated box of tricks. It represents a medical revolution.
This is a massive change to people. They will be in hospital in shorter period. Fewer people will actually have to go to hospital. Sports injuries will be healed quicker, and the world will be a better place. This is Nobel Prize-winning equipment. So how does it work? Well, first stop on my investigation took me not to the Emirates or the subcontinent, but to Cyprus. The Cellsonic medical machine generates VIPP, which means very intense pressure pulses. VIPP enables changes to the body cells without drugs or surgery. This is non-invasive tissue regeneration without side effects. Cellsonic has developed its own technology and in the last 2 years has seen astounding healing results. A machine is in daily use at a clinic in Paphos. It's here that the powers of Cellsonic are being developed for the lucrative beauty industry. It treats cellulite, much to the delight of the local female population. The clinic reports that back problems, core strength, and arthritis all respond well. Most amputations in the UK are carried out on people who have severely reduced blood circulation in one of their legs or feet. It could be a result of peripheral arterial disease or the complications of diabetes. But what about medical evidence? That's vital if the Cellsonic claims are to be believed. Well, orthopedic surgeon Dr. Arjun Viegas from the M.N. Budrani Cancer Institute in Delhi says, "A means of performing non-invasive surgery is a dream come true. And this is what Cellsonic does by using special, fast sound pulses to hit the bones and joints." He goes on to say, "The cost savings are valuable. My department now regards Cellsonic as central and essential to our performance as a reputable orthopedic and physiotherapy hospital." Senior consultant Dr. Mahajan Pradeep, Honorary Associate Professor of Regenerative Medicines and Cell-Based Therapy at Seven Hills Hospital in Mumbai, described Cellsonic as incredible. On wounds, the results are almost unbelievable. With extreme cases where amputation would have been inevitable, the infection is killed and vascularization improves immediately the pulses are applied. Large wounds are healing almost without scars. With Cellsonic, we feel confident to work on cancers that I would not otherwise have attempted. We've also found the support from the entire Cellsonic team to be first class. His colleague, Dr. Manu S. Menon, clinical head at Seven Hills, says, "I have never before come across a means of healing without drugs or cutting that causes healing so easily and effectively. Every hospital and clinic needs a Cellsonic, and if anyone doubts this,
I shall be pleased to speak with them personally. In Poland, Dr. Peter Sadkowski is a specialist treating musculoskeletal, chronic inflammation diseases of joints, and chronic muscle and chronic pain. He says, in our patients we obtained pain relief, improvement in physical function and movement. Progress in the treatment of vascular ulcers exceeded our wildest expectations. We can certainly recommend this equipment for treatment in others. I had equally glowing reports from South America and Germany and Switzerland, where dermatologist Dr. Christian Busch is pioneering the use of Cellsonic. He reported that an 81-year-old patient lived with painful, oozing wounds for 50 years, but was cured with just 4 Cellsonic treatments.
The biggest single cost area for all countries is wound care. Make that into wound healing so that the patients with wounds don't have to be cared for, dressings changed 2 or 3 times a week. The saving to the British National Health Service with a population of 60 million would be 2.4 billion, not million, billion pounds a year, every year. Now, with Cellsonic, it can be non-invasive, no cutting, no drugs, and the immune system is brought into action, because that's the real only way to bring about healing. And that's the cure. If there's any infection in there, those shock waves are blasting through into the body where that infection is, be it a virus, bacteria, or even a parasite. And it hits it and stretches it, and it comes back under its own elasticity, and 1/4 of a second later, another wave is banging through it until eventually it's killed. Now, you don't know what that infection is, you don't know exactly where it is, you don't need to.
For me, what we do is all about the outcomes. It's all about what this machine can do. So whether it's cellulite and it removes the cellulite, whether it's wounds and it heals the wounds, or whether it's simply a sports injury and getting somebody back fit and healthy, it's the outcome. It's what the machine does that always appeals to me.
There's a massive opportunity to come in and be part of this wonderful, wonderful product. A small investment is all that needed. I've calculated some $13 to $14 million would get this on the road, and that would be spent mainly in marketing, distribution, and in gearing up the factory. I've seen some of the most awful injuries before and after, and the benefit of what it does. It does sound too good to be true. My first impression was it was, but when I saw it, saw how it worked, saw the work done by certain medical people and others, and the results and the photographs, I realised it wasn't too good to be true, it works.
I'm back where we started. I've dug deep and reported the facts. And one thing is obvious to me. The international potential of Cellsonic is absolutely enormous.